Hello, Pharma friends. Welcome to Pharma Syndrome YouTube channel. In this session, we will discuss regarding MCQs of autonomic nervous system with explanation. And before that, subscribe to our channel Pharma Syndrome and follow Pharma Syndrome for daily updates regarding pharmacy education and pharma competitive exams. And a reminder to you, so there is a many upcoming notification in the state level as well as central level throughout the India, including pharmacist, drug inspector, and other pharma competitive exams. So please be prepared. Nothing but start your preparation prior to the notification. So if you require any coaching like GPAT, Sniper, Drug Inspector, Pharmacist, you can contact me on 7995318103. Let's enter into the session here. The first MCQ is, so here the first MCQ is, which of the following is not a neurotransmitter of sympathetic nervous system? You know, sympathetic nervous system, also known as adrenergic nervous system. The neurotransmitters in sympathetic nervous system are adrenaline, noradrenaline, as well as dopamine. So combinedly these three called as monoamines as well as catecholamines: adrenaline, noradrenaline, dopamine. And here, so histamine, adrenaline, as well as norepinephrine and dopamine are there. So you know, histamine is belong to the histamine receptor, and histamine is not a part of sympathetic nervous system neurotransmitter. Dopamine, adrenaline, norepinephrine, nothing but noradrenaline. So these are the neurotransmitter of sympathetic nervous system, but histamine is not a neurotransmitter of the sympathetic nervous system. And you know, sympathetic nervous system also known as a fight or flight system. Fight or flight system. And histamine is a neurotransmitter contains imidazole. It is a neurotransmitter containing imidazole nucleus. Next, second question. Next is the second question here. Rest and digestive activities is other name of the following nervous system. So here it is a central nervous system, and here it is a PNS, peripheral nervous system, and SNS, sympathetic nervous system. PSNS is a parasympathetic nervous system. So the parasympathetic nervous system or cholinergic system, also known as rest and digestive activities, because through the parasympathetic acetylcholine releases, that acetylcholine involves in our rest as well as digestion activities. So here the answer is parasympathetic nervous system. Our answer is parasympathetic nervous system. And next is the question number 3, the rate limiting enzyme. The rate limiting enzyme in the, so here it is, the rate limiting enzyme in the catecholamine biosynthesis. So catecholamines are nothing but adrenaline, noradrenaline, dopamine. They also known as monoamines. They also known as monoamines. That is adrenaline, noradrenaline, as well as dopamine. And here dopa decarboxylase is the answer. Sorry, option. Dopamine beta hydroxylase, phenyl ethanolamine N-methyl transferase, tyrosine hydroxylase. So answer is the tyrosine hydroxylase. So tyrosine hydroxylase converts phenylalanine to the tyrosine by addition of a OH group to the phenylalanine, that converts to tyrosine, and that requires enzyme tyrosine hydroxylase. If this enzyme was inhibited, there is a no catecholamine biosynthesis, and the enzyme is called as tyrosine hydroxylase enzyme. That is rate limiting enzyme involves in the catecholamine biosynthesis. And dopa decarboxylase involves in degradation of the dopamine. And phenyl ethanolamine N-methyl transferase involves in conversion of norepinephrine to epinephrine in the adrenal gland or suprarenal gland. So the answer is here, the rate limiting enzyme in the catecholamine biosynthesis is tyrosine hydroxylase. Tyrosine hydroxylase. And next, so what is the inhibitor? So which drug inhibits tyrosine hydroxylase enzyme? Tyrosine hydroxylase enzyme. So here the option metirosine, brimonidine, guanethidine, cocaine. As you know, cocaine is a local anesthetic as well as CNS stimulant. And cocaine is the only local anesthetic, does not require co-administration of adrenaline to prolong local anesthetic duration of action. అంటే జనరల్గా లోకల్ అనెస్టిక్స్ అన్నీ కూడా లైక్ ప్రొకైన్, టెట్రాకెన్, బెంజోకెయిన్ అవన్నీ కూడా కాంబినేషన్ గా అడ్రినలిన్ ఇవ్వాలి. ఎందుకంటే కనుక లోకల్ అనెస్టిక్ అనేది ఎక్కువసేపు పర్టికులర్ ఏరియాలో ఉండి దాని యొక్క యాక్షన్ ప్రొలాంగ్ గా చేయాలంటే కనుక అడ్రినలిన్ కంపల్సరీగా ఉండాలి. ఎందుకంటే అడ్రినలిన్ వాసో కన్స్ట్రిక్షన్ చేసి ఆ లోకల్ అనెస్టిక్ చాలా సేపు కూడా ఆ పర్టికులర్ లోకల్ ఏరియాలో ఉండేటట్టు యాక్షన్ చేసేటట్టు హెల్ప్ చేస్తుంది. కానీ కొకైన్ కి వాసో కన్స్ట్రిక్షన్ ప్రాపర్టీ ఉండటం వల్ల అడ్రినలిన్ కాంబినేషన్ అవసరం లేదు. Cocaine itself a vasoconstrictor and so prolong its duration. So it does not require adrenaline as a vasoconstrictor agent. So cocaine is not the answer. And guanethidine. Guanethidine is a adrenergic neuron blocker, prevent release of noradrenaline from presynapse to postsynaptic receptor. And brimonidine. So brimonidine is a alpha 2 receptor agonist, and metyrosine or methyltyrosine is the inhibitor of rate limiting enzyme of catecholamine biosynthesis, that is tyrosine hydroxylase enzyme. So cocaine requires cocaine does not require co-administration of adrenaline, but remaining all local anesthetic require co-administration of adrenaline to prolong action of local anesthetic. And next question is the autoreceptor is. So which of the following is a autoreceptor? Autoreceptors, also called as presynaptic receptors, are negative feedback control of the presynaptic neuron. So here beta 3, so adrenergic beta 3 receptor, it is located on the adipose tissue and urinary bladder. It is not a autoreceptor. And alpha 1a receptor, alpha 1a receptor specifically located in the prostate gland. The selective alpha 1a blocker is tamsulosin, used in prostate cancer, benign prostatic hyperplasia. And alpha 1 receptors are located on the blood vessels. Excess activity of alpha 1 receptor on the blood vessel by binding of noradrenaline develops vasoconstriction and develop blood pressure. And alpha 2 receptors present in the central nervous system, and alpha 2 receptors are autoreceptors, inhibit release of their own neurotransmitter. When alpha 2 receptors are activated, what will happen? There is a no release of neurotransmitter. When alpha 2 receptors are activated, inhibition of noradrenaline release. And alpha 2 receptor agonist acts as a antihypertensive drugs like methyldopa as well as clonidine. సో ఆటో రిసెప్టార్ ని ప్రీసినాప్టిక్ రిసెప్టార్స్ అని కూడా అంటారు. సో ఎప్పుడైతే ఆటో రిసెప్టార్స్ యాక్టివేట్ అయితే వాటి యొక్క ఓన్ న్యూరో ట్రాన్స్మిటర్ రిలీజ్ ని అవే ఇన్హిబిట్ చేసుకుంటాయి. So, and moving to the next question. The next question is, which of the following drug inhibits vesicular monoamine transporter? Which of the following drug inhibits vesicular monoamine transporter that inhibit with the storage of catecholamines? So which of the following drug inhibit vesicular monoamine transporter and interfere with storage of catecholamines? For example, this is the presynaptic neuron. Once any neurotransmitter synthesized, for example, assume it is a presynaptic neuron of sympathetic nervous system. So once noradrenaline synthesized or dopamine synthesized, it should be stored in the synaptic vesicle. So from here it have to transport to the synaptic vesicle. For this require vesicular monoamine transporter. If this vesicular monoamine transporter was inhibited, then no storage of neurotransmitter in the synaptic vesicle, and there is a breakdown or degradation of neurotransmitter. Like here also, one of the following drug inhibiting this transporter and preventing the storage of the catecholamines. And here it is the reserpine, metyrosine, ephedrine, clonidine. Clonidine is a alpha-2 receptor agonist, and ephedrine is a mixed-acting sympathetic drug, and metyrosine is a inhibitor of rate-limiting enzyme, that is tyrosine hydroxylase. And reserpine is the answer. Reserpine is from the Rauwolfia serpentina, belong to the family Apocynaceae, and the synonym is sarpagandha. Reserpine inhibit vesicular monoamine transporter and interfere with the storage of catecholamines and increase the degradation of catecholamines, which helps in treatment of hypertension. That's why reserpine used as an antihypertensive drug. But nowadays it is not using because of its drawback depression, and also there is availability of excellent drugs like selective alpha 1 blockers, selective beta 1 blockers. So nowadays reserpine not using as a antihypertensive drug. And moving to the next question. Moving to the next question. Which are the following receptor? So the question is here. Which are the following receptor present in juxtaglomerular cells of kidney? So beta 2 receptor located on the lungs, bronchial smooth muscle. Beta 1 receptor and alpha 1 receptors located on the blood vessels, alpha 2 receptors located on the central nervous system. The answer is beta 1. Beta 1 receptors are located on the heart, as well as beta 1 receptors located on the kidney, especially juxtaglomerular cells of the kidney. The right answer is beta 1 receptor. So along with heart, beta 1 receptors also located on the kidney, especially juxtaglomerular cells. Next question. So, choose the correct one regarding following receptor and function. అంటే కింద ఇచ్చిన టేబుల్లో ఆ రిసెప్టార్ దాని యొక్క ఫంక్షన్ ని మ్యాచ్ చేయండి అండ్ ఇన్కరెక్ట్ వన్ ని గుర్తించండి. సో ఐడెంటిఫై ద ఇన్కరెక్ట్ వన్. ఐడెంటిఫై ద కరెక్ట్ వన్. So here beta 1 receptor causing relaxation of cardiac muscle. No. Activation of beta 1 receptor when adrenaline is binding, it causes contraction of the cardiac muscle, increases number of contraction, increases number of beats, and increases conduction velocity of heart. So it is incorrect. And next, beta 2 thermogenesis. Beta 2 receptor present on the lungs. It causes relaxation or dilation of bronchial smooth muscle, but not thermogenesis. But thermogenesis is a function of beta 3 receptor in the adipose tissue. And next, alpha 1A. Alpha 1A receptor present on the prostate gland promote the prostate gland growth. So this is the correct answer. And none. It is the incorrect answer. So the correct answer is here. Alpha 1A receptor present on the prostate gland and supports the prostate gland growth. Excess activation of alpha 1A receptor increase the growth of prostate gland and develops benign prostatic hyperplasia, which can be treated by using tamsulosin, selective alpha 1A receptor blocker. And if patient having benign prostatic hyperplasia along with benign prostatic hyperplasia along with hypertension, then selective alpha 1A receptor blockers like josin, alfujosin, terazosin, doxazosin are useful. If only benign prostatic hyperplasia in patient, then only selective alpha 1A receptor blocker used. Next, first drug of choice for treatment of anaphylactic shock. So anaphylactic shock is a type of severe allergic shock because of excess histamine concentration in the blood that leads to develop severe allergic reactions. And high or severe allergic reactions may develop into anaphylactic shock. Anaphylactic shock. So here options. So dopamine is not a drug of choice. So dopamine is a general neurotransmitter and also a catecholamine and also a monoamine. And bupivacaine is a amide local anesthetic. And noradrenaline is also neurotransmitter but not a treatment for anaphylactic shock. But adrenaline is a answer, and adrenaline for the treatment of anaphylactic shock because adrenaline is a physiological antagonist of histamine and it decreases high concentration present in the blood. సో బ్లడ్ లో ఉన్న హై కాన్సన్ట్రేషన్ ఆఫ్ హిస్టమిన్ తగ్గించి ఆ సివియర్ అలర్జిక్ రియాక్షన్ అతిమట అనాఫిలాక్టిక్ షాక్ ఆర్ అలర్జిక్ షాక్ ని తగ్గిస్తుంది. సో ఎడ్నలిన్ ఈజ్ ఏ ఫిజియోలాజికల్ యాంటగోనిస్ట్ ఆఫ్ హిస్టమైన్ అండ్ హెల్ప్స్ ఇన్ ద ట్రీట్మెంట్ ఆఫ్ anaphylactic shock nothing but severe allergic shock. Severe allergic shock. And next question. So the next question is dipivafrin is a prodrug of. So adrenaline, reserpine, cycloguanil, dopamine. Again, dopamine is a neurotransmitter and it is also a chemically monoamine as well as catecholamine. And cycloguanil is a anti-malarial drug. Cycloguanil is an anti-malarial drug. That is a prodrug. And reserpine is a antihypertensive drug, generally from the plant source Travolpia serpentina. And here it is a adrenaline is a prodrug of adrenaline is a prodrug of dipivafrin. So once dipivafrin enter into the body, it releases adrenaline, and this useful in the treatment of glaucoma. The prodrug used in glaucoma is dipivafrin. Once dipivafrin enter into the body, dipivafrin converts to the adrenaline. Next question. Neurotransmitter causes dilation of renal arteries and increases rate of glomerular filtration. So, if renal arteries are dilated, blood flow to the kidney increases. If blood flow to the kidney increases, glomerular filtration rate increases. The same function can be performed by prostaglandins also. And here, what is the neurotransmitter causes? Dilation of renal arteries as well as increased rate of glomerular filtration rate. And here, glutamate. So glutamate is generally a excitatory neurotransmitter, especially related to the pertain to the central nervous system. And next, dopamine. And adenosine is a neuromediator. Adenosine is a neuromediator having different function. Adenosine in the brain produces sleep. Adenosine on the lungs causes constriction. Adenosine on heart relaxation, nothing but decreases heart rate. Adenosine on platelets increases platelet aggregation. So adenosine not a answer. And epinephrine also known as adrenaline. And the answer is dopamine. Dopamine having its dopaminergic receptors on the kidney. When dopaminergic receptors on the kidney, especially renal arteries, are activated, leads to dilation of renal arteries and increases cardiac output to the kidney and increases glomerular filtration rate. If GFR increases, urine formation also increases. Next, which of the following is a indirectly acting sympathomimetic? So regarding the general classification of sympathetic nervous system, nothing but drugs acting on sympathetic nervous system, three categories: directly acting, indirectly acting, mixed acting. Okay, so in that category, which of the following is indirectly acting sympathomimetic? You know, sympathomimetic means the drug or substance mimics the activity of adrenaline, noradrenaline on adrenergic receptors. So, indirectly acting sympathomimetic. Phenylephrine is a selective alpha-1 receptor agonist, comes under directly acting category. Clonidine, selective alpha-2 receptor agonist, and it is also known as directly acting drug. Apraclonidine, also a alpha-2 receptor agonist. So directly acting drugs means they directly interact with the receptor. Indirectly acting means they show action in different ways, but ultimately increase the neurotransmitter level. That neurotransmitter binds to the receptor. And mixed acting means having action of both direct as well as indirect. And the answer is here amphetamine. Amphetamine does not directly binds to the receptor. Initially, it increases catecholamine levels, and that increased catecholamine binds to the receptor and acts as a sympathomimetic. So, the indirectly acting sympathomimetic is amphetamine. Amphetamine is a generally CNS stimulant. Especially it can increase noradrenaline as well as dopamine levels. Next, which of the following drug inhibits release of acetylcholine from presynaptic neurons? So, which of the following drug inhibits acetylcholine from presynaptic neurons? For example, ecothiopate. Ecothiopate is an organophosphorus compound, comes under irreversible inhibitor of acetylcholine esterase enzyme, and ecothiopate is the only organophosphorus compound. Ecothiopate is the only organophosphorus compound for the treatment of glaucoma. And next is the hemicolinium. Hemicolinium. So this hemicolinium interfere with acetylcholine biosynthesis. Next, botulinum toxin and vesamicol. Vesamicol is a drug inhibits vesicular uptake of acetylcholine into the synaptic vesicles. So synaptic vesicles లో acetylcholine స్టోర్ అవ్వకుండా చేసే డ్రగ్ vesamicol. And answer is here botulinum toxin. So botulinum toxin from the Clostridium botulicum organism. So this inhibits release of acetylcholine from presynaptic neuron to the postsynaptic neuron. Postsynaptic neuron. And next is the next question. Selective beta 3 receptor agonist is selective beta 3 receptor agonist is oxymetazoline. It belongs to the alpha receptor activity. Ritodrine is a non-selective beta-2 receptor agonist. Generally, it relaxes uterus smooth muscle. Uterus smooth muscle also containing beta-2 receptor. And triazolam is a benzodiazepine, comes under sedative and hypnotic. And next is a sola bagran, amibagran, mirabegran, MIRA. All bagrans are selective beta 3 receptor agonists. Beta 3 receptors present on the urinary bladder as well as adipose tissue. Urinary bladder as well as adipose tissue. On the urinary bladder causes relaxation or dilation of urinary bladder smooth muscle. On the adipose tissue increases thermogenesis or increases lipolysis, breakdown of lipids. Next question. Terbutaline. Terbutaline is a drug of choice for. Terbutaline is a drug of choice for. So congestive heart failure. So it is congestive heart failure related to the heart. So terbutaline not for the treatment of congestive heart failure. Hypotension. So not for decreasing blood pressure. Not a shock, allergic shock. So terbutaline is a selective beta-2 receptor agonist which is located in the bronchial smooth muscle, and selective beta-2 receptor agonist useful for the treatment of asthma like salbutamol, terbutaline, albuterol. All these are comes under treatment of asthma. Next, selective blocker of alpha 2 receptor which is present in the Ravolfia. So like reserpine, which is from the Ravolfia serpentina, and one of the intermediate also from Ravolfia serpentina that also inhibits alpha 2 receptors. That also inhibits alpha 2 receptors. And here it is the first one is sotalol. So sotalol is a non-selective beta blocker. Sotalol is a non-selective beta blocker, and the sotalol can also be a class 3 antiarrhythmic agent. Sotalol can also be a class 3 antiarrhythmic agent. Next, midodrine. Next is the midodrine. So midodrine also acts as a agonist on the alpha receptors. And next is the edazoxan. Edazoxan also a non-selective alpha receptor agonist. And that is the next is answer is yohimbine. So yohimbine is from the Rauvolfia itself, and it is a selective alpha 2 receptor blocker. Selective alpha 2 receptor blocker. And idazoxan also a alpha 2 receptor blocker. Alpha 2 receptor blocker. Then the drug of choice for cheese reaction. The drug of choice for cheese reaction. So cheese reaction generally observed during when any cheese products, any dairy products are enter into the body, that a dairy products may increase the tyramine levels. So tyramine is also a monoamine which can increase the catecholamine levels like noradrenaline, adrenaline. If noradrenaline, adrenaline levels increases, there is an increasing severe hypertension that may called as cheese reaction. So the reaction is nothing but increasing in the blood pressure to severe condition, severe blood pressure. That is because of increasing tyramine in the body. So increasing tyramine in the body because of taking dairy products into the body, taking dairy products into the body. So here, which of the following drug is a drug of choice for the cheese reaction? సో చీజ్ రియాక్షన్ జనరల్గా మనం చూస్తే కనుక చీజ్ రియాక్షన్ అనేది అంటే మన బాడీలో కొన్ని డైరీ ప్రొడక్ట్స్ తీసుకున్నప్పుడు అంటే మిల్క్ ప్రొడక్ట్స్ లాంటివి తీసుకున్నప్పుడు అవి ఏం చేస్తాయి అంటే కనుక బాడీలో మోనోమైన్ థైరమైన్ లెవెల్ ఇంక్రీజ్ చేస్తాయి. దట్ థైరమైన్ కెన్ ఇంక్రీజ్ ద కెటకోలమైన్ లెవెల్స్ అండ్ సివియర్ ఇంక్రీజ్ ఇన్ కెటకోలమైన్ లెవెల్స్ మే డెవలప్ సివియర్ బ్లడ్ ప్రెషర్ ఆర్ హైపర్ టెన్షన్. సివియర్ బ్లడ్ ప్రెషర్ ఆర్ హైపర్ టెన్షన్. దట్ సివియర్ బ్లడ్ ప్రెషర్ ఆర్ హైపర్ టెన్షన్. That severe blood pressure or hypertension may because of dairy products like increasing tyramine content. So the here answer is phentolamine. Phentolamine is a non-selective irreversible alpha receptor blocker for the treatment of cheese reaction. So not a doxazosin. Doxazosin is a selective alpha 1 receptor blocker. Tolazoline also a non-selective alpha receptor blocker, that is reversible category. And phentolamine is the answer. And monoamine theory will explain depression. What is the reason behind depression can be explained by using monoamine theory. Phentolamine, tolazoline are non-selective reversible alpha receptor blockers. But phentolamine is drug of choice for cheese reaction. Cheese reaction is because of ingestion of dairy products may increase tyramine level. That tyramine increase the catecholamines. Severe increasing of catecholamines develops severe hypertension called as cheese reaction. If the severe increasing BP because of ingestion of dairy products, then it is called as cheese reaction. Next. And next MCQ is irreversible non-selective alpha receptor blocker. Irreversible non-selective alpha receptor blocker. Reversible non-selective alpha receptor blocker. Here, alpha 1 plus alpha 2. Non-selective. Non-selective reversible or phentolamine tolazoline. And irreversible non-selective here, phenoxybenzamine as well as dibinamine. D-I-B-E-N-A-M-I-N-E. Dibinamine. So phenoxybenzamine is answer. Phenoxybenzamine is irreversible non-selective alpha 1 plus alpha 2 receptor blocker. So tamsulosin is a selective alpha 1A receptor blocker. Doxazosin, alfuzosin both are selective alpha 1 receptor blockers, commonly known as josins. And josins chemically contains a quinazolin group, heterocycle quinazolin group. The same quinazolin group present in the Vasaka, a natural alkaloid for the treatment of asthma. And next question is alkaloid blocks alpha 1 receptor. Alkaloid block alpha 1 receptor. So for example, corianthin. Corianthin is the alkaloid can block alpha 1 receptor. And yohimbine is a selective alpha 2 receptor blocker. Yohimbine also a alkaloid from the plant source, but it selectively blocks alpha 2 receptor. And ephedrine is a mixed acting sympathomimetic agent. And thibine is a narcotic opioid category. Correct answer is chorianthin is a natural alkaloid, blocks alpha 1 receptor. Blocks alpha 1 receptor. Next question. Tamsulosin is drug of choice for. Next question is tamsulosin is drug of choice for. So here it is the question. Tamsulosin is a drug of choice for which are the following condition? Which are the following condition? So here first is the Ray's syndrome. So Ray's syndrome is a type of allergic reaction because of excess use of aspirin. Okay. And pheochromocytoma is a cancer of the adrenal gland, suprarenal gland. And hypotensive shock, that is a shock due to low BP. So these are the not conditions. Tamsulosin is a drug of choice. Tamsulosin is a selective alpha 1A receptor blocker useful for the treatment of benign prostatic hyperplasia. Benign prostatic hyperplasia. So tamsulosin is a selective alpha 1A receptor blocker. Alpha 1A receptor located on the prostate gland. Located on the prostate gland. And next, which of following drug is not belongs to first generation beta blocker? Which are the following drug not belongs to first generation beta blocker? So for example, sotalol, propranolol, nedolol. So for this purpose, regarding the classification of beta blockers, I already made a video on our channel Pharma Syndrome. You can go and watch there with excellent tricks and mnemonics you can easily remember. In that first generation, second generation, third generation of beta receptor blocker, I gave the video. So please watch it. So here the answer is acebutolol. Acebutolol is a selective beta blocker, comes under second generation beta blocker, and sotalol, propranolol, nedolol comes under the first generation beta blocker. First generation beta blockers are non-selective, second generation beta blockers are selective, and third generation beta blockers are mixed acting drugs. Mixed acting drugs. Next, non-selective beta blocker used in treatment of glaucoma. Non-selective beta blocker used in treatment of glaucoma. Nebivolol is a mixed acting third generation beta blocker. Etinolol is a selective beta 1 receptor blocker. Tamsulosin is a selective alpha 1A receptor blocker. So here the question is non-selective beta blocker in the treatment of glaucoma, that is timolol. Timolol is a non-selective beta blocker for the treatment of glaucoma. Chemically, it contains a thiazole as well as morpholin rings. Thiazole as well as morpholin rings. And next question. Next question. D-isomer of nebivolol selectively blocks beta 1 receptor. Its L-isomer stimulates the release of. So, nebivolol comes under third generation beta blocker. It comes under mixed acting. So, there are two isomers of the nebivolol. One is D-isomer, one is the L-isomer. The D-isomer activity is selectively blocking of beta 1 receptor, and the L-isomer action of nebivolol is releasing a nitric oxide. Nitric oxide is a potent vasodilator in the body, causes dilation of smooth muscle of blood vessels. And nitric oxide, also known as endothelium derived relaxing factor, EDRF, endothelium derived relaxing factor. And nitric oxide is known as gaseous neurotransmitter in the body. So the answer is nitric oxide, because prostaglandins also vasodilator, but L-isomer does not release prostaglandin. And adenosine is a neuromediator having different function, and adrenaline is a also neurotransmitter. But D-isomer of nebivolol selectively blocks beta 1 receptor, and L isomer of nebivolol increases release of nitric oxide. Nitrous oxide N2O is laughing gas and also a general anesthetic category. General anesthetic category. Next, one of the following is not a clinical use of propranolol. So below I mentioned all are the clinical uses of propranolol. Propranolol is a non-selective beta blocker. It is a first generation beta blocker. First generation are non-selective. And propranolol is contraindicated in asthma. So here propranolol can be used in alcohol withdrawal symptoms, can be used in anxiety as a anxiolytic agent, can be used in hyperthyroidism to reduce excess sympathetic activity. సో జనరల్గా ఆల్కహాల్ యూజ్ చేస్తూ సడన్గా ఆపటం వల్ల కొన్ని విత్డ్రాల్ సిమ్టమ్స్ వస్తాయి. అంటే ఒక్కసారిగా హార్ట్ రేట్ పెరగటం, యాంగ్జైటీ ఎక్కువ అవటం. సో వాటిని తగ్గించాలంటే ప్రొపనాల్ వాడతాము. యాంగ్జైటీ, యాంగ్జియస్ మనిషిలో ఆందోళన, యాంగ్జైటీ ఎక్కువైనా కూడా సింపాథటిక్ సిస్టమ్ యాక్టివ్‌గా మారుతుంది. దాన్ని తగ్గించాలన్నా ప్రొపనాల్ ఇస్తాము. హైపర్ థైరాయిడిజం, హైపర్ థైరాయిడిజంలో థైరాయిడ్ హార్మోన్ లెవెల్స్ ఎక్కువవుతాయి కాబట్టి థైరాయిడ్ హార్మోన్ లెవెల్స్ ఎక్కువైతే హార్ట్ రేట్ కూడా పెరుగుతుంది. పెరిగిన హార్ట్ రేట్‌ని కంట్రోల్ చేయాలంటే ప్రొప్రానోలాల్ ఇవ్వాలి. బట్ ప్రొప్రానోలాల్ ఈస్ నాట్ ఏ డ్రగ్ ఆఫ్ చాయిస్ ఫర్ ఆస్తమా అండ్ ప్రొప్రానోలాల్ షుడ్ నాట్ బి యూజ్డ్ ఇన్ ఆస్తమా బికాస్ ప్రొప్రానోలాల్ ఇన్‌స్టెడ్ ఆఫ్ డిక్రీజింగ్ ఆస్తమా ఇట్ మే ఇంక్రీజ్ సివియారిటీ ఆఫ్ ఆస్తమా. సో ప్రొప్రానోలాల్ అనేది ఆస్తమా తగ్గించడం కాదు, ఆస్తమాని పెంచుతుంది. సో ప్రొప్రానోలాల్ షుడ్ నాట్ బి యూజ్డ్. Propranolol should not be used in the asthma. And next, paralysis of ciliary muscle. Next MCQ. Paralysis of ciliary muscle is called as not a meiosis, constriction of pupil of eye, not a mydriosis, dilation of pupil of eye, not a vasodilation. So the paralysis of ciliary muscle is known as cycloplegia. As cycloplegia. The answer is cycloplegia.